Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
A stroke can steal speech, movement, even memory, but fast action can change everything. Being able to recognize the initial signs can mean the difference between recovery, permanent damage, or even life and death. Today, we have Dr. Abena Annor, neurologist with Baptist Health Brain and Spine Care, who is here to share her knowledge with us about strokes, as well as answer your questions. On this episode of Ask the Doc, no appointment needed. I am Julie Donaldson, and welcome to Ask the Doc, No Appointment Needed, the show where we encourage our viewers to send in their health questions. Let's kick things off with a question from Belinda, who reached out to us through our website at allhealthtv.com. Now, Belinda asked, "Hi, Dr. Annor. I have a strong family history of stroke, and I've heard the acronym FAST can help you remember the warning signs. So please tell me what it stands for." Belinda, that is a great question and a great way to start this show, Dr. Annor. If you'd be so kind, we'd love to have you share what FAST stands for so folks can help their families.
Yes, absolutely. FAST is a great acronym to remember, the stroke signs and symptoms, and to get you to know that you have to act quickly to help people get to the hospital and get the care that they need. So the F in FAST stands for face. The A stands for arm, the S stands for speech, and the T for time. So the face, it's like a facial droop where you're not seeing somebody moving the lower parts of their face as well. Sometimes it can be the upper part of the face, but it's mainly the lower part that we're looking for. And then for like arm, it's if they're weak in one arm, the left arm, the right arm. That also reminds you to, look for weakness in the legs too. And then speech is just like any changes in speech where they're having difficulty speaking, or when you speak to them, they don't understand, or if their speech is slurred. And then of course, T is the time, which is to get them to the hospital as soon as possible, which would be like calling 911, so that, the emergency service can come pick them up and take them to the hospital.
The quicker you can recognize the signs, the better chance you have at helping and saving somebody, right?
Absolutely.
How much time is at risk here? How quickly? I know you want to ask fast, and it is what fast says, but how much time do you really have to be able to help somebody have less consequences from this?
So the reason why it's so you need to get people to the hospital quickly is because there's two main acute interventions that we do for an acute stroke. The first one is a blood thinner medicine, a very strong blood thinner medicine that we can only give if you're within 4.5 hours of your last known well. And then the other one is a surgery where they can go and take out the clot, if it's like a clot that's blocking your blood vessel. And right now we're only able to do that safely if you're within 24 hours. So that's kind of what puts the time pressure on getting people to the hospital as soon as possible, because you can only get the strong blood thinner medicine within 4.5 hours of your last known well. And then same thing with the thrombectomy, that's the surgery that they do to go pull out the clot. You can only get it done if you're within 24 hours of your last known well.
Okay, recognize the signs and move quickly. A great way to start this show. We have another question here. This comes from DeAndre. He says, "Hey, Doc, we hear a lot about strokes, but who is actually at higher risk? And what can people do today to prevent one? As a Black man with high cholesterol and some extra weight, I want to know what I should be doing." Dr. Annor, DeAndre asks a really important question here.
Yes, absolutely. So in general, the risk factors for strokes are basic things like high cholesterol, having diabetes, having high blood pressure, smoking. Those are the big risk factors for strokes. And so working on those things really will help decrease your risk for having strokes. And not only just strokes, those are also risk factors for other cardiovascular diseases. So heart attacks, And so like working on those helps decrease your risk for stroke and also other issues that might lead to mortality. And so, with high cholesterol and diabetes, it's a lot of diets, trying to, manage your diet and have a better diet. In stroke care, we typically recommend Mediterranean diet. So a diet low in fat. And for stroke care as well, we recommend like exercising. And that's like your typical exercise in about 150 minutes in the week. And so it's kind of all the basic things like with your diet and with your exercise that decrease your risk for strokes is the same kind of things that decrease your risk for other medical issues as well.
Okay, got to take care of ourselves to try to prevent these things from coming. It's some good advice. Our next question is from Facebook page, and it's from Rory, who asks, Dr. Annor, if someone thinks that they are having a stroke, what should they immediately do? I'm asking because my father has high blood pressure, and I want him to be as proactive as possible. Rory, that's good to look out for your dad. Now, doctor, what should somebody do immediately if they think that they or loved one is experiencing a stroke?
So that goes back to the FAST acronym. So quickly call 911 and get the emergency service to come get them and take them to the hospital. So that, we can give them those acute treatments if they're able to get those done. And then, if they do have a stroke too, then we can manage them in the hospital for the complications of the stroke.
Is there anything somebody can do at home if a loved one is experiencing a stroke to try to make them more comfortable or help to de-escalate the situation at all?
I think the main thing is like trying to get them to be more comfortable, like you're saying, and then making sure you have their medical history when you come with them to the hospital, like trying to gather all those things. Those are very helpful in us deciding if those acute treatments are safe for them. And so, making sure you have their medicines that they're taking, their if they have any papers that discuss their medical history, making sure you bring those as well, making sure that you can confirm their last known well, which a lot of times people confuse with the symptom onset. Last known well is when, anybody last saw the person at their normal self. And then the symptom onset is when the symptoms started. So it's different. And those acute interventions, they're based on the last known well, which is when the last time anybody saw them at their normal self. And so the main thing, before trying to get them to the hospital is just making sure that you're able to gather all those informations because they help us decide, is it safe to give them those acute treatments?
That's a lot going on if somebody's experiencing it, but yet it's so important to stay calm to help the person and really to be able to help the doctors when they do get to the hospital, the best care that they can give them. So really great tips there, I'm sure, for anybody that's watching and listening to this. Up next is another great question from our allhealthtv.com page, and this time it is from Kai. Kai says, Hi, Dr. Annor. I'm studying to be a nurse practitioner, and I'd like to know what are some myths about strokes that you wish more people stop believing? Okay, that is a great question that we're getting from Kai here, doctor. And so we put together actually a list of common stroke myths. Let's go through them. And you kind of tell us, your response to these. Now, the first one that everybody kind of tends to go to is that strokes only happen to older people.
Yes, that is one of the more common myths. But so it's not so much older people that strokes happen to, but it's, those risk factors that we talked about before with the cholesterol, the diabetes, high blood pressure, and smoking. Just older patients tend to have those classic risk factors. So then you tend to see strokes more in older patients. But now younger people are also starting to have those risk factors. So you get to see, strokes in younger patients as well. And then outside of that, younger people also have other risk factors for strokes that are not as common. And so things like autoimmune diseases or diseases that cause a lot of inflammation in the body, they can put you at risk for strokes as well. Lifestyle things like cannabis use, alcohol use, all those things are things that you might see more in the younger population. And those things also put you at risk for having strokes.
Okay, so it's not just older people, and a lot of it goes to a lifestyle as well, and to be cautious of that. Now, this next common myth is if symptoms go away, well, it's not serious.
Yes, that is very serious. So not every symptom is a sign of stroke. If you have like some numbness and tingling that's lasting for like a few seconds, that's unlikely to be a stroke. But if it's lasting for like 10 minutes, and it goes away, it could be a sign of what we call a TIA, which is called transient ischemic attack. That's what that stands for. And it's essentially a stroke, but it doesn't last for more than 24 hours. Like you have the symptoms, but they go away within 24 hours. And that is just as risky as having a stroke, because that is a sign that you're at high risk of having a stroke in the next couple of days. So we take that as well very seriously as like kind of a prelim to you having a stroke in the next couple of days. So we do all the same workup. We typically will have you on an aspirin as well. So our management is similar to somebody who had a stroke. And so those are also like important symptoms to be evaluated for if you have them and they go away.
That kind of leads to this next myth as well, what you're saying there, that you can wait and see if it gets better.
Yeah, it does lead to the same things I discussed here. So yeah, even if it goes away, you should definitely get evaluated. It might not need to be emergent, like calling EMS for them to come pick you up, but you should definitely go to the hospital or make an appointment with a neurologist or even your primary care doctor to get checked out. Because also a lot of these symptoms, especially when they go away, people might not be aware that's this TIA. It could be something else, but it will be good to get evaluated so that, they can see if this was a TIA or if it was something else. So definitely get checked out if you have those symptoms, even if they go away.
It's not worth risking it at all, that's for sure. This next one, strokes are always painful.
Yes, not entirely. So you can just have like a weakness where that's not painful. You just kind of lose function. And a lot of times too, actually, stroke is more like you lose function. So you're weak, you're numb, you can't speak. So it's more loss of function, which is not necessarily painful per se. And sometimes when some people have like very big strokes, they're not even aware of it. So that's certainly a myth.
You alluded to this before in one of the first questions on how your lifestyle could impact your risk of stroke. But this next myth, uncommon myth here, only unhealthy people have strokes. What about people that don't participate in that? Are they still subject to potentially having a stroke?
Yes. So some people have genetic risk factors for having stroke. Some people also just have, like it previously said, autoimmune diseases that puts them at risk for having strokes. Some people are just at higher risk for forming blood clots. And so, they might have healthy lifestyles, but they still end up having strokes. And that's actually quite common in women. Where generally strokes in women, they tend to be what we call hypercoagulable, where they're just at high risk of forming blood clots. And so they tend to have the kind of strokes that are not your typical ones that you see, and they'll present with symptoms that are not typically your classic stroke presentation. And so definitely it's not just, having an unhealthy lifestyle, just due to some other medical issues that you might have or some genetic risk factors, you can also still have strokes.
Right. And what about recovery? Another myth here that says recovery is not possible after a stroke.
So that is absolutely wrong. It takes some time though, for sure. It's not sudden. Sometimes you do see the recovery, while they're still in the hospital, but usually it takes a couple of months, typically like around 9 months for you to see kind of your maximum amount of recovery. And so it takes patience and then time and working with physical therapy as well. But definitely people do recover.
I think that was really great to go through. Thank you for that. I know that answers probably a lot of questions for people with that, but we do have more questions to get to. So let's carry on. This next one comes from Clara, and it's from YouTube. She says, Dr. Annor, how important is communication and coordination between emergency responders, ER teams, neurologists, neurosurgeons, and rehabilitation specialists when treating a stroke patient? Clara, that's so great. And thanks for reaching out. Dr. Annor, tell us why this kind of coordination is so important and vital to the care of the patient.
Yes, that's of utmost importance. Stroke care is like team-based care. It's not just one physician doing things. It's multiple physicians from multiple specialties, and also just multiple other healthcare professionals all involved in this. So it's a coordination of all the people in this team that helps us get people the care that they need. And a lot of the advances that we've been able to have in stroke care is kind of smoothing out that coordination, so that when somebody comes to the hospital and there's a suspicion for stroke, we can quickly get them the care that they need. And so yeah, definitely like team-based care is the way that we're able to get all this accomplished.
I love hearing that. And I love that people are working together to try to help the person that is in need for that, the importance of it. Blake has a question, and it comes from Facebook. And he says, what advances in stroke treatment and technology are helping physicians treat strokes faster and more effectively today? All right, Blake, thank you so much for this. So Dr. Annor, now I've heard there's some amazing technical innovations that are really making a difference in stroke care. So tell us about them.
So I think like the main things right now in stroke care is trying to extend that acute window. So for the strong blood thinner medicine, the limitation is right now the 4.5 hours, but there's a lot of research trying to see, is it safe to extend it? And they're kind of ongoing right now. And similar for the surgery where they go and pull out the clot. That one's also really indicated within 24 hours of your last known well. But again, there's also a lot of research going on to try to see, is it safe to expand that? And so like that's kind of the main thing in stroke care right now, trying to see how we can safely expand the window so that a lot of people can still get it, even if maybe they come outside of the window. In terms of like technology wise, they just recently approved a device called Vagenix. It's a device that stimulates your pharynx to help with swallowing. Because one of the big things with post-stroke, a lot of people have issues with swallowing. And that's very complicated because not only, people like to eat. And so like not being able to eat can be devastating. So outside of that, when you're not able to like swallow your secretions well, that puts you at risk for having pneumonia, which can just kind of worsen your hospital stay and just kind of bring about other complications that you weren't expecting. And so like that device helps kind of improve how long you will be not able to swallow, and just kind of makes it faster, your recovery for your swallow abilities.
All good things. And we love to have continued advancements as well to help in these situations. Now, our next question comes from YouTube, and it's from Poppy, who asked Dr. Annor, what happens to stroke patients after the immediate emergency is over? How do hospitals, physicians, and other medical caregivers help them through recovery and rehabilitations? Doc, I want to know more about this myself as well. So, Poppy, I'm glad that you're asking this question.
Yes. So, after the acute care in the hospital, a lot of the work in terms of recovery is done. Either you go to a hospital that's particularly like a rehab hospital, and there you have like rehab doctors and you have other therapy doctors like physical therapy, speech therapy, occupational therapy. and they all kind of work together to help you with your recovery. Some people might not need to go to a rehab hospital. They might just go at home and get their therapy to come to their home with them. Other people end up going to like a skilled nursing facility where they can get rehab there. And so it's kind of rehab is like a whole different specialty with like a whole different doctor that just specializes in rehab. And they kind of help guide the team in getting the best recovery for the patient. And like I said, it takes some time. And that's probably where the most intense work happens for the patient. But you will eventually get there, but it takes some time. It takes dedication. It takes patience.
Okay, doctor, let's continue on here. This next question comes from Serafina, who reached out to us on allhealthtv.com and asks, are there certain patients who are at higher risk for stroke, and what steps can people take now to lower their chances of having a stroke? Dr. Annor, many people, they have hypertension, diabetes, and other conditions that we've kind of talked about that increase their risk for stroke, right?
Mm-hmm. Yes, absolutely. And I think that's what I like to drive home. That's the point that I would like to drive home. It's kind of those basic risk factors that you can work on, like your cholesterol, your diabetes, your blood pressure, and not smoking, limiting your alcohol use. All those are things that are within our power to change. And changing them really helps decrease your risk for stroke. So, if there's one thing that I want to get across with this, it's to make sure that, we work on our lifestyle, because definitely changing your lifestyle can decrease your risk of stroke. So, changing how you eat and making sure you exercise and those basic things will decrease your risk for stroke.
I'm listening to you, doctor. I hope everybody else is as well. Here's the next question. It comes from Lachlan, who reached out to us on Instagram. Dr. Annor, how do alcohol intake, poor diet, and limited exercise affect stroke risk? Okay, this is the point that everybody seems to want to get to. How much exercise do they need? I know you mentioned Mediterranean diet, but what about if you want to get off the diet just a little bit? Like, where is that fine line in your weight being too much, there being too much smoking, too much alcohol? Because people might want to partake in some of those activities that aren't necessarily so good for us.
Yes, I agree on that. With life, it's a balance. It's a balance that I think it's different for everybody. If you're more older, you probably want to err on the side of not, being too loose with that and like be more stricter with your diet and exercising. But perhaps if you're younger, you can here and there be more loose with that. In general, for exercise, we recommend 150 minutes in a week, which can be all at one time, but many people recommend doing it like 3 times, 50 minutes 3 times a week, or you could do 30 minutes 5 times a week, to kind of break it up and make it more manageable. And then for the diets, we do recommend the Mediterranean diet for stroke, but the broad lesson is to just kind of limit fats, and have less salt in your diet, and just like eat more fruits and vegetables. And so that's kind of the broad lesson in terms of the diets. And so, yeah.
Let's get one more question in here quickly. This comes from Ira on Facebook, and it kind of goes to you and your work in this. It says, Doctor, I'd really like to know what you are excited about when you look into the future of stroke care. We don't have much time, but give us a quick answer here.
Yes. I am most excited about telestroke. So, in patients who are in kind of rural areas, it's sometimes the access to neurologists is not very great. But telestroke allows you to do that. You can just connect to a neurologist very fast. And I'm excited for that expanding to thrombectomy as well, where maybe, telesurgery will be a thing, where you don't have to like move the patient to a different hospital, but you can, keep them there with like our advances in robotics and get the surgery done over there.
Okay, very good. That's all the time we have for today. I'm Julie Donaldson. We'll see you next time on Ask the Doc.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.